In this issue of the Running Specialist Report, we're going to talk about everything you should know about relative energy deficiency, or REDS-S. So relative energy deficiency in sports. And a lot of us are very familiar with the no pain, no gain adage, but this is not the case when it comes to relative energy deficiency. Relative energy deficiency is going to be lower available energy levels compared to energy expended during exercise. So essentially here what we're talking about is people are not bringing enough fuel in, they're not having enough energy to be able to do all the things they want to do. And unfortunately, relative energy deficiency in sport can affect bone health, sports performance, and menstruation. And we also really see a high risk for those folks that are in weight-based sports like wrestling, for example, or appearance-based sports like gymnastics, or endurance-based sports like running or cycling. Now, PTs on a whole are not on the front line of people to treat relative energy deficiency in sport. Now, we would make a referral to sports therapists, nutritionists, functional medicine practitioners, and that would be a good way to be able to help our patients. But we do see patients quite a lot. We're on the front lines with folks and we see them a little more often, especially if they're recovering from an injury. This is a great time to bring up the idea that potentially they're not bringing in enough fuel to be able to help themselves and ultimately get better. So, what is relative energy deficiency when we talk about it? Well, it's going to be things like losing bone structure, irregular menstruation. It's going to be talking about compromised immunity, gastrointestinal upset. And also, it can decrease your sports performance, even your coordination or your concentration or your ability to be able to recover after you exercise. And this is a really good tool that I'll make a link for you. And you can see that this has a lot of different things that relative energy deficiency can relate to. Bone health, menstruation are two they used to call the triad. And then we also can see GI issues, metabolic issues, psychological issues, or cardiovascular. There can be a ton of different issues here. It's really important to screen for this. And also, while we're on this topic, how does it relate to sports performance? Well, we decrease our training response. We are higher risk for injury. They're going to get bone stress fractures, things like that. And then they're going to have decreased coordination, potentially some depression or irritability as well. So we want to screen for these things to make sure patients aren't suffering from relative energy deficiency. And how should we go about screening folks? Well, there's some really helpful tools, and especially the clinical assessment tool is a great one I'll link to. But what we can do is we can categorize runners into high, moderate, and low risk. And these high risk individuals are going to be those with a history of an eating disorder, maybe anorexia, maybe another eating disorder, or other psychological issues, or potentially an extreme amount of weight loss that they are losing and they're potentially life-threatening. They're not able to be stable. They're really suffering and need to have more nutrition. Also on that, we can see this is going to relate to things like abnormalities in the EKGs or ECGs. And so we're noticing that folks are going to have a little bit of a different presentation. That's obviously our higher risk folks, but the moderate risk is kind of the place we need to really screen for people the most. If they're at that high risk, they're probably having a litany of issues, but that moderate risk, while they may still be able to participate in some sports, we want to be able to catch this and help them get the resources they need early. So this would be things like a very low body fat percentage. This would also be things like having a low bone mineral density index. Also, prolonged amount of energy availability. They're always being tired. They're having abnormal menstruation cycles or maybe an absent menstruation cycle, especially in developing females. We want to be very cognizant of that. And then we also want to look to see if they do have a history of an eating disorder, or potentially they're having a behavioral issue where they're thinking to themselves, I can't eat if I don't exercise, or look, I look so much bigger. And while they've actually gained muscle strength, they're commenting on the fact that they're looking bigger and they don't like their appearance, even though it is more fit, it's more healthy for them. Those are all things we want to screen for. Now, as I mentioned before, PTs aren't really on the front lines when it comes to treating these issues, but dietitians, nutritionists, functional medicine practitioners, sports mental therapists are all helpful individuals, and we want to be able to give our patients and our runners the best resources we possibly can. So using the directory from the American Academy of Nutrition and Dietetics is a really good resource. You can find someone that is close to you that specializes to work with runners, and you want to make sure that those people have a familiarity of what runners need. You don't want just them to be able to give general advice. You want someone that is going to be running and sports focused. And also check out the complete REDS CAT, C-A-T. So that's going to be our relative energy deficiency in sport clinical assessment tool, which can be a really good way. It has some of these visuals that I shared with you today so that you can go over and be able to see different and be able to educate patients on what relative energy deficiency is.